Kaiser Permanente has been an ABMS multi-specialty portfolio program sponsor since 2011. In the last 5 years, more than 5,000 physicians have completed projects offered by our portfolio program. Our projects have become more robust over the years. Now all our projects include 2 PDSA cycles, and we cull our electronic medical record for advanced metrics to support our projects. In addition, we use adult educational principles. Many of our projects start locally, with physicians designing projects to address local quality initiatives. They then send the projects up to the national office where we make sure the projects align with national quality goals. We now offer more than 130 different projects in 8 states across the country. The response to these projects is overwhelmingly positive. In addition to getting their maintenance of certification credit, which they love, physicians also say that these projects are empowering and reinvigorating. Our portfolio program projects are meant to save and improve the lives of the patients that we serve. In one of our projects, we set out to decrease high-risk opioid use. And in that project, we decreased the number of patients at risk for opioid death by half. It's projects like this that make us very proud to be a portfolio program sponsor.